Welcome to the James Rice Show, a humorous, entertaining, and sometimes thought-provoking look at teaching and studying abroad. Join the conversation as James guides you through his experiences and provides insights into how to improve your English and how to improve your teaching of English. And now, here's the man you've been waiting for, James Rice.
The coronavirus. Do you need to panic? Do you need to wear a mask? Do you need to stay indoors? Can you travel? We will bring you the latest, including my experience with the SARS virus and breakout in Toronto in 2003, all coming up on The James Rice Show. Hello, my students and fellow educators out there. Welcome to this week's very special broadcast coming to you from Toronto, Canada, where we have begun to see the coronavirus enter into North America through the United States, through Canada, obviously from passengers coming from Wuhan, China. Welcome to the James Rice Show, and I'm telling you and bringing this show to you because, well, we have an English expression. And the English expression we say, this ain't my first rodeo. This ain't my first rodeo. And for the students out there, this means I have been through this before. All right? This ain't my first time. This is not my first time. And I want to bring some of my experiences into this show, and I want to bring in some experts into the show that I listen to and rely on and trust during some of these outbreaks and medical crisis that we see. And I was here in 2003 in Toronto, and I owned my own language school. At that time, it just opened, actually, and we were hit by SARS. Now, SARS is a more lethal, deadly virus than the coronavirus. Now, it is the same family. So there are many types of coronaviruses we've seen out there. We've seen SARS, which hit Toronto in 2003 and devastated, destroyed our city for, well, a good year, but certainly the summer of 2003 was a horrible year. It was a horrible summer. And also there was MERS, M-E-R-S. That was in the Middle East. So this is not something too new. Now, it is a different strain. It is a different type of coronavirus than SARS, than MERS, but it is the coronavirus. So we do have some experience and some knowledge about this virus. So don't feel too much, in my view, that the doctors don't know what's going on. And of course, you know, the number one way to get any virus, whether it is the coronavirus, the MERS virus, the SARS virus, the Ebola virus, the bird flu, it's through the media. Yeah, even though I am part of, I guess, that media complex. The number one way to get the virus is by watching all of the news and stuff on television, all right? They're making money, okay? It's called clickbait. They want to scare you. They want to shock you. And frankly, honestly, there are shocking things happening in Wuhan, China. And Wuhan is definitely going through a major, major crisis. But beyond Wuhan, you know, we need to be careful, obviously. We need to be vigilant. That means we need to take seriously anybody coming out of Wuhan, China, and to protect ourselves from those people. But this is a Wuhan, China problem right now. It is spreading slowly, I get it, but it is not spreading like a wildfire. Now, like the media is projecting. Now, I do want to bring in someone that was recently, I'm going to bring in clips from this gentleman who was recently on CBC television. He is Dr. Michael Gardam, Chief of Staff at Humber River Hospital, which is a major hospital here in Toronto. And he was quite active during SARS, and he was working through it. And I want you to listen to him, and I want you to learn how the virus is spreading. Okay, so Stephanie, our lovely producer, can you play clip 2, please?
Yeah, well, they're basing it on the fact that all the epidemiologic evidence right now says that this is transmitted within close contact of people, and the definition that we've used for years is within 1 or maybe 2 meters. So that's why they're saying 1 to 2 meters.
Okay, so the way that you are getting this virus is through the nose and through the mouth, perhaps through the eyes. There is a report on that, and the doctor is going to talk about that a little bit later, that is probably not true. And then basically it gets into your system. It finds a cell, and usually in your lungs, and then that cell kind of explodes and infects other cells, and it spreads like that. So your symptoms are a runny nose, a cough, sore throat, high temperature, which is pretty much fever-like symptoms. All right. So now you may be thinking, oh my gosh, if I leave and I fly and I go abroad, I am going to get the virus by being on an airplane. Now, I just came back from Los Angeles, California, where I was at a conference, and I must say I was quite worried about this fact. I thought, okay, maybe no one around me has the virus, and maybe nobody in the airport, that near me has the virus, but, somebody could sneeze, right? They could sneeze and the virus will go out into the airplane, even the guy sitting at the back, or maybe that person over, in the airport who is, 10 miles away from me sneezes, and sneeze travels 1,000 miles per hour. It could land on my tongue when I open my mouth talking, and I'm going to get the virus that way. Well, let's listen to the doc about this very situation where he talks about flying and being in an airplane. And actually, flying in the airplane, it may not be as bad as you think. All right, let's play clip number 3, Stephanie.
Although people hate the air on airplanes, the reality is in modern planes, it's actually HEPA filtered as it is being recirculated. So there, first of all, isn't much of a concern of airborne transmission of this virus. And secondly, if there were, it would be cleaned up by the filters. This is really an issue of close contact sitting right next to the person.
Okay, but I read in the newspaper, read in a tweet, somewhere on Twitter, that, hey, it is transmitted by air and through someone's eyes. So that's why everybody's wearing masks and glasses, and so I could breathe it in, or it could get into my eyes. Somebody could sneeze or anything. I've also heard it is like splitting in the air. Is this really happening? And I was caught up in that. I was thinking, I just came back from Los Angeles, where they just had a confirmed case in California, right through the LAX airport. That's where I flew. Do I have it? Well, let's play clip number 5 on that airborne stuff. And is that a real fear? Clip number 5, Stephanie.
The people that are in danger of transmitting this are the people who are really sick. I know there's been a lot of speculation over the last 24 hours about asymptomatic transmission. And truly, that was based on a paper that was published on the weekend regarding one patient, and it was speculation, and there were other ways that patient could have picked that up. So I don't want us to go down the asymptomatic transmission route. There's nothing to suggest that that's a very significant way that this is spreading. It really is people who are quite sick with it.
Yeah, so I was wrong, and I was worried. I was scared. I was fearful because I'm flying through LAX, where one confirmed case, and I flew into Toronto, where another case had just been released by the media. So I'm flying right through these 2 major airports, and the doc saying, look, it was speculation. There was some guess by some research that possibly, maybe, could be one patient got it through the air or through the eyes and not through close contact. But there has been no evidence, no scientific evidence that is happening. Now, we don't know, of course. We don't know. No one knows for sure. And, of course, when you see those videos out there and all of that media that's out there, and I've posted a few in terms of what's happening in Wuhan, China, and they've shut the city down. I mean, it is a disaster area in Wuhan. And what you're seeing is a lot of panic, and a lot of scared people If they have a runny nose or if they're feeling sick, they immediately go to the hospital thinking they have the virus, and it's overwhelming. And it is it's overwhelming the system. The system cannot handle it. Okay, there's just too many people worried and scared. And of course, we don't have enough hospitals to handle an entire population being scared and running to see the doctors. And of course, doctors and nurses are being overwhelmed with cases and with stress. And I think I posted on Facebook and my Instagram account, so if you can follow me on the James Rice Show, Facebook is James Rice Show, and Instagram is Connect with James, you'll see the video from the nurse from one of the Wuhan hospitals, and talking about just the sheer stress, I can't imagine what they're going through trying to handle all of the patients. Because let's face it, if your child, if your father, if your husband or wife is sick, you are worried and you are scared and you want help immediately, and you got all of those people very, very worried. Now, this is flu season, okay? So people get the flu, which is a very common problem. If we didn't have the coronavirus, you would have said, oh, my father has the flu. Now, your father has the flu, you're thinking, yes, the coronavirus. Oh my gosh, I got to get him to the hospital. And you're overwhelming the system. And that's what's happening in Wuhan. And of course, being in the hospital, what we learned from SARS in Toronto 2003, being in the hospital is the fastest way that virus can spread, because it's kind of a clean area. And it is very easy for a virus to spread in the hospital through that clean, sanitized area. And that's one of the things that we learned in 2003, that the hospital is one kind of dangerous area. Now, that doesn't mean don't go to the hospital, but as the doc explains, I'm going to bring him on again, Stephanie, as the doctor explains, what we are doing here in Toronto is what we learned from 2003 to how to handle those cases when they walk through the door in Toronto, so and in Canada generally. So let's talk. Let's play clip number 7, Stephanie, where the doctor's talking about how it is handled here in Canada.
Yeah, that's exactly right. And that gets to my earlier point, right? That the patients are most infectious when they're very sick. And where do they go? They go to the hospital. So what we've been doing ever since 2003 is asking all patients when they come into the emergency department, for example, do they have symptoms of cough and fever? And if they do, we give them a mask. We've been doing that for years. What we're adding on now is, have they traveled to Wuhan City? And if the answer is yes, they'll be whisked into an airborne isolation room, and then staff will be wearing gowns, gloves, respirator, and a visor when they see the patients. That's all stuff that we learned from SARS. When SARS happened in the beginning, we didn't do any of that.
And of course, the doctor is correct. What happened in 2003 in SARS was we had no idea what was going on in Toronto and generally around the world. It was the first coronavirus that was out there, and it was deadly. I mean, if you got it, you were dead. I mean, that's the message that was getting out through the media. And frankly, the doctors did not have a clue as to what was going on. And they also did not protect themselves. So some of the people who died during SARS were nurses. And that was the tragedy of SARS. And I see some of this happening in China because a lot of the people that are getting information out into the public through WeChat and through underground channels in China are the nurses. They're seeing it. They're firsthand. They're seeing what's happening, and they're scared, and they're worried. And frankly, what has happened in China, as to my understanding as well, is that this virus appeared in December. So 1 month before it became, kind of this pandemic or this incredible outbreak. But it appeared in December. And the government told people in Wuhan, told people in the hospitals not to worry, it is okay. And that was the wrong thing to say, the wrong thing to do, and obviously they're paying the full price right now. But somewhere along the lines, the Chinese government thought it was okay. Now, in fairness, they are being open and transparent now, and they're trying to get WHO, the World Health Organization, into China to help them. But it may be, maybe too late in some cases, because Wuhan is quite infected already. And of course, they're shutting down the city. They're quarantining, and quarantine means to keep the people inside the city. They're not allowing travel from that region to enter or to exit. So they are taking a number of steps now, but obviously they are very, very late to that party. And one of the things that worries me is, will it change? How will it change? Will the virus change? So will it become airborne? So that's the big risk. And will it start to fly out there as the cold does, or as the flu does? I mean, the cold and the flu is a virus that flies around all the time. We always get it. And you may get the flu and it may affect you seriously, and I may get the same flu, but nothing happens to me. I just maybe get a sniffle or a little cold. Or you may get a cold, I may get a cold. The same cold flies around very quickly and then dies out. So the concern, of course, is if it becomes airborne. And here's the doc talking about that and his worry and what we should watch for.
The key question, though, is whether we see transmission after that. Do we start to see local spread here in the city? And right now, there's very little to support that that's happened anywhere in the world except for China.
So what the doc is talking about here is something called the generations of a virus. All right. And I've done a little bit of research for the James Rice Show listeners out there to help you to understand when this virus or any virus may become super dangerous to humanity, and it may end the world, or at least travel in a way that is quite dangerous for people. So first generation of the virus means that it has jumped from the animal to humans. So it is obviously the most deadliest part of the virus. So that's those people who perhaps have eaten the bat or the snake or whatever they've eaten, the animal that they've eaten that actually has the virus, and it mutates and becomes part of their body, and they die quite quickly. And that's kind of that stage one, first generation. The second generation, that is the people who are close to those people who have eaten it. So let's imagine the situation where your husband eats the bat soup, which is one of the delicacies, one of the food from Wuhan, China, eating a bat. Like Batman. So they're eating the bat, and then he gets sick, but he gives you a kiss goodnight, and that kiss makes you sick. So now you are second generation of that virus, all right? So it's coming into contact with you. Now, the third generation, so we're seeing that a lot, second generation people in Wuhan. Now, the third generation of the virus is people who receive the virus from other people from Wuhan. So let's say, again, you have the husband who kisses the wife. The wife then travels to Canada and gives their daughter a hug. That now the daughter becomes infected. That daughter now is that third generation. Okay, so all of that is all still connected through Wuhan, China. The risk, and this is what the doctor was talking about, the big risk is when it becomes the fourth generation. And that's when the daughter sneezes, hachoo, and it goes out into the subway. And suddenly, I receive it. I don't know the daughter. I don't know the mother. I don't know the father or the husband who ate the bat soup. I don't know any of these people. I got it because she sneezed or coughed. That's where the danger lies. And that's kind of the fourth generation of the virus, or the fourth stage. Now, generally, hopefully, as it gets to the fourth stage, it becomes weaker. I mean, that's the theory. And as any virus goes, as it travels from human to human, it becomes weaker and weaker, not as strong. That's why the cold virus doesn't kill us anymore. But the flu virus did, 200 years ago. It killed, millions of people. Okay? Now, I do want to talk about something serious that we learned here in Canada when we had SARS. And maybe we can play, I'm not sure, maybe we can play a clip from the doc. Do we have another clip, Stephanie? No, I think he's talked a bit about the SARS already, right? So let's just talk about what we learned here, what I learned specifically about SARS and the SARS virus and how I got through some of that. And when SARS came, like I mentioned before, when you got it, it was a death sentence. And what we've learned, of course, like all the coronavirus, it can be a death sentence if you are an elderly man. So one of the people who have died with the coronavirus, he was 88 years old. I mean, he got the coronavirus and it killed him. And or if you have respiratory problems, so perhaps you have lung cancer or bronchitis, or you have pneumonia already and you pick up the virus, that is also going to be quite deadly. And or if you have diabetes, that's what they say. Another one, here I am on I'm on a health kick. I'm trying to eat healthy, and you can see another reason why you got to cut out sugar and all of those problems in your diet. But one of the big lessons that I think we learned here in Toronto about SARS was how to communicate to the public. All right, China was not open and transparent when this event occurred. I mean, they are now, but they were not. And they started to cancel events, Disneyland's closed. But how we communicate is so important during a crisis. And when we had SARS, when it hit, the first time they did not communicate well. So we actually had SARS twice. Can you believe it? We had 2 breakouts in 2003. I mean, can you imagine if that happened right now? In 2003, I believe it was March or April, we had the first breakout. And the communication from the government was, everything is fine, everybody. Don't worry. It's going to be okay. It's just a small little breakout. Everything's fine. And the reason why the government did this was because of the economy, money. They were worried that this would affect our travel and tourism trade. So people would not want to come to Canada if they heard there was a viral breakout of major virus in our city. So their communication was, it's okay. It's all right. Don't worry. We're fine. But we were not fine. And they didn't know what they had. And they didn't know what was going on. And they said after about a week, and I think there was a lot of pressure on the government from businesses and industries to say this. They said we were free and clear of SARS in about a week. Now, if you know about SARS or if you know about the coronavirus, then it takes 14 days for it to be really clear. So they told us in 7 days, everything's fine. And I was part of that travel and tourism industry as a language school owner. So I had many people wanting to come to Canada to travel, many students who were enrolling. And it was actually my first big summer. And I put the message out to everybody, Toronto is fine. I remember saying that. I remember writing those emails. I remember telling language travel agents, education agents, hey, we're all fine here in Canada. Everything's good. Don't worry. Trust us. Well, that was the worst thing to say, and that was the worst thing that the Canadian government could do, and they put out information that was wrong, inaccurate, and misleading. What happened? Of course, 7, 8, 9 days later, we had SARS breakout 2. I believe it was, again, April, May, in the spring, and panic, pure panic hit Toronto. I mean, nobody, number one, nobody believed the government. Number two, nobody was going to come to visit Canada. To Toronto specifically, Canada, yes, but Toronto specifically. Toronto became a ghost town. There was nobody on the streets. I would take the subway in the morning. If you live in Toronto, you know subway is very busy. Or if you live in New York or Brazil, São Paulo, you guys know subways are very busy. Can you imagine? The subway was almost empty. I mean, it was almost empty in the middle of summer, in the middle of travel and tourism season. There was nobody. I used to say to people, I could take a bowling ball and roll it down Yonge Street, which is the major street in Toronto, the main street of Toronto, where all the businesses and tourism activity. I could just take a bowling ball. I could throw it down the street. It would not hit anybody because there's nobody in our city. The government misled, lied, tried to hide, tried to do things for the wrong reason. So what we learned, and what I'm seeing now here in Canada, is the government are holding press conferences. They're bringing in the World Health Organization, whom I truly respect in these crises. So if you want accurate information, information that is scientific, go to the WHO website, the World Health Organization. They're on top of it. They're following it. They know when the viruses are becoming more and more dangerous. Now, they're saying Wuhan is a dangerous place right now, WHO. Wuhan is infected and it needs to be quarantined, which the Chinese government doing. But that's all that's happening. They're not saying any other city, any other place is in any danger. Just Wuhan, China. So our government had 2, sometimes 3 press conferences a day. We had doctors coming out. We had people like that doctor, Dr. Gardam, who you just listened to. They would come out. They would talk to us. They would tell us. They would explain to us what was happening. And, that made the situation calmer. And it brought everybody to realize, like, guys, you don't have to run to the hospital. If you're feeling sick, if you have a little cold, you have a little fever, you go to the hospital if you've had these situations. And they tried to bring it under control, and they tried to inform us. And I remember the countdown of the people who had the virus. So I don't remember the exact number, of course, but I think there were 80 people with the virus. And then after a day, that dropped down to 77 had the virus. Then it dropped down a day to 55 had a virus. Then went up to 57. We've got 2 more cases. And we were watching the countdown. We were watching it, countdown, all through the summer of 2003 until there were 0 cases of the SARS. And the government was on the television telling us the numbers, being accurate and being open and being transparent. And that's not what we're seeing come out of China. And that is the scariest part about this virus. If the governments are not open and not transparent and do not tell the truth to people, you get panic. And you get panic like we're seeing in Wuhan, and you're getting panic like you have never seen before. And we did it right the second time. The first time, we did not do it right. We did it for all the wrong reasons. All the wrong reasons. Okay, so let's listen once more, Stephanie, to the doc. Let's see what he has to say about what we should do to just protect ourselves. So, like I said at the beginning, you need to be careful. Okay, you need to be vigilant. Okay, vigilant means to be very, very, very super careful around people. All right, now more so than before. All right, and the doc has some advice about what you should be doing.
So right now, I would argue business as usual. Do the same things that you do during regular flu season. Wash your hands, stay away from sick people, and if you're sick yourself, don't go off to work and infect somebody else.
Very good advice, and please, everybody, just be smart and be careful, okay? And don't panic. Don't panic. That's the first rule here. Oh, I do want to talk about masks. Something I forgot to mention. Should you buy a mask? Should you wear a mask? Now, there are some very good masks out there. So if you are a person, I'm not going to convince you not to wear a mask. But if you do want to wear a mask, I think the top masks here, the price in Canadian dollars, it's like $100 for 20 masks. And those are the masks that nurses wear. So if you're going to get a mask, make sure you get a good one. Okay, don't just buy those cheap surgical masks. If you really feel you must wear a mask, get a good one. However, everything I say, everything I read, everything I see, I should say, everything I see and everything I read says the masks do not necessarily work for you. And here's why. For the everyday person, here's why. What happens is when you wear the mask, you tend to take off the mask to speak, or if you want to eat the food. And the problem is, if you touch something that maybe is infected, you're bringing your fingers and your hand up to your mouth, and you're taking off the mask, and you may be breathing in those viruses. And it may not be the coronavirus, it may be another virus. So there are some hazards to wearing a mask. So if you're going to wear a mask, do not touch the mask, okay? Go outside, wear the mask, and come back in. Do not touch it. Do not take it off to talk. Do not put it on and off. So do not pull it down and put it up, pull it down, because all you're doing is just giving yourself more reason to catch some sort of virus or some sort of disease. So that's what I hear, and that's what I want to pass on to you. Now, because I hear so many things and I read so many things, and I am out there learning more and more about the coronavirus, and the reason why I'm so interested again is because of my experience with SARS and how it almost devastated my business. I mean, I almost went out of business, really, because nobody was coming to Toronto. I mean, I could not give away my language classes. I remember offering it free to people, and they would not come to Toronto. So I feel for what's happening in Wuhan. I feel for the people. I feel incredibly worried about their livelihood. It's going to devastate them economically, not to mention their health, but for years and months and years to come. It's going to be so hard. Wuhan now has it's a famous name for a virus, and that's just not cool. And I can just see so many difficulties for them. And I've lived it in 2003. Like I said off the top, this ain't my first rodeo. I have experience with this, and I'm going to be sharing my experience as we learn more about this virus, as it unfolds. I'm going to be trying to bring some more people onto the show this week. Now, so please subscribe first. Please subscribe so you can keep up to date. Now, remember, my show, we do the new episodes on Monday, Teacher Talk for Teachers on Thursday, and the free English lessons for students on Saturday. But I'm going to be trying to bring on guests throughout the week, if I can get them, to come on to the show to talk about the coronavirus. I've reached out to a number of experts. I'm hoping to get one of them on to talk about it. And I'm also reaching out to people in China. All right, people who are willing to be brave, because there are some people who do not want to share information on social media for fear of the government, and that scares me. That scares me. We have to be open and transparent. This is about, the community of the world that we live in. This is not about communism or capitalism or China versus America or trade wars or anything like that. This is about the health and welfare of the citizens of this planet. Okay, and people who are fearful, it worries me, because information is the key at this point to stop the spread of panic. All right, so I'm going to try to reach out to those people in China. I'm going to try to get them on the show. Some may be anonymous. Some maybe don't want to share their own names, but we'll see if we can get them to come on and talk to us on the James Rice show, and keep everybody updated and informed, because that is the key. Information is the key. You need to have the correct information. Follow WHO. Okay, that's great. Follow Canadian news sources, the CBC, the Canadian Broadcasting Corporation. Again, our government is very good at sharing information, and it's because we learned our lesson. We learned We learned in 2003 that we need to be open and we need to be honest with people and we need to give information. So check out the Canadian sources. I think they're providing some really good, honest information. Sometimes a little panic, sometimes a little clickbait. Clickbait, that's a new vocabulary. Clickbait means that you guys, they want you to click on it so they can make money. So there's a lot of panic stories like that and a lot of shocking stuff out there. So remember, be crazy, but please be safe.
Thanks for listening to The James Rice Show. Don't forget to subscribe to our newsletter and send us your questions or comments at www.thejamesriceshow.com.